Hey everyone, thank you for clicking on this video. My name is Melissa and this is the Lucky Nurse Lectures. So in today's lecture, we're going to be talking about a condition called epiglottitis. Before we talk about the condition of epiglottitis, I very briefly want to go over the epiglottis, what it is, where it's located, and what it does. So in very basic terms, the epiglottis is a small flap of tissue in the way back of our throats that covers our trachea. So now that you know what the epiglottis is and where it's located, we're going to talk about the function of the epiglottis. Basically, the primary function of the epiglottis is protection. It serves as a gatekeeper that keeps food and liquid from getting into our body's respiratory system. So like I mentioned, the epiglottis serves as a gatekeeper basically for the throat. The way that it works specifically is that the epiglottis stays open when we are inhaling air and when we are exhaling air. And it's very smart. It knows to close whenever we are consuming food. So anytime that we're eating food, anytime that we're drinking liquids, anytime that we're even swallowing, the epiglottis will close to make sure that no food or liquid goes down into our airway. Now that we've talked about the epiglottis, we're going to go back to talking about epiglottitis. So epiglottitis is a very serious condition and a very dangerous condition that happens when that epiglottis in the back of our throats becomes inflamed. Once the epiglottis becomes inflamed or swollen, it blocks the airway passage and it prevents air from flowing into and out of our lungs. Epiglottitis, of course, is a medical emergency and it has a very abrupt onset, meaning that it happens very suddenly. So it must be treated quickly because without airflow going into and out of the lungs, you can't survive very long. So some classic signs and symptoms of epiglottitis can include a sore throat or a patient reporting that they have pain when they're swallowing, the patient having a fever. Sometimes a patient may start tripoding. You see a picture on the screen. That's kind of where your patient will be hunched over. Sometimes their hand or their forearm or their elbow will be on their legs. It's a position that people go into when they are in extreme pain or when they're having trouble breathing. So make sure to look out for tripoding. If you see your patient drooling, this can also be a sign of epiglottitis. When you're doing your assessment and looking in their mouth, if you notice that their mucous membranes are super red or inflamed, that is also another sign. If your patient, especially if they're nonverbal, if they start seeming anxious or restless, all of these are common signs of epiglottitis. Now, what causes this condition? Epiglottitis has some different possible causes, and in this lecture, we're only going to go over a few. So some potential causes of epiglottitis are bacterial or viral infections, burns. If someone is burned badly enough externally, that can cause the epiglottis to swell up and lead to epiglottitis. Physical injury, if somebody gets hit hard enough in their throat, that can cause epiglottitis. And last and most importantly is Haemophilus influenzae type B, also referred to as Hib. This is a bacteria, and I know that I already mentioned that bacterial infections can cause epiglottitis, but I listed this bacteria separately because this specific bacteria is a common cause of epiglottitis in children. It used to be more common of a cause in previous days, but today, fortunately, we do have a vaccine that can prevent children from getting epiglottitis. Next, we're going to talk about interventions. Epiglottitis is a critical issue that requires immediate care and attention. And so the very first thing that you need to do with this condition is to make sure that you get emergency airway equipment into the room with the patient if you have some available. If you are not in a healthcare setting and you don't have any available, you're going to want to call 911 and then you're going to try to calm the patient down as much as you possibly can. Now, imagining that you are in a healthcare setting with all of the appropriate equipment that you need, the primary interventions are listed on the screen. IV antibiotics will be used to treat infections that are causing epiglottitis. Steroid medications are used to decrease the inflammation and the swelling of the epiglottis so that the airway can open up a bit and the patient can get air into their lungs. breathing assistance tools, so like oxygen masks or breathing tubes, and IV fluids. So IV fluids are not going to stop or really improve the epiglottitis, but since the airway is blocked and the throat is blocked off, your patient will not be able to have any oral hydration. So IV fluids are a great way to make sure that they do not become or stay dehydrated. Lastly, we're going to talk about prevention methods for epiglottitis. The most effective way to prevent a child from getting epiglottitis is to make sure that their vaccinations are up to date, especially that Hib vaccination that I talked about earlier. It is a vaccine series that starts in children as early as 2 months of age. So that's really the best preventative measure, especially for children. Also, practice hand hygiene. Like I mentioned, bacterial and viral infections can be a cause of epiglottitis. So for the viral infections, you're going to want to make sure that you are taking proper precautions when you are around people that are sick. Make sure that if they're coughing, they're covering their mouth, or if they're not, that you are covering your mouth and your airway so that you do not contract any viral infections. And lastly, try to avoid super hot beverages so that you can avoid internal burning of the epiglottis. So that was a very quick rundown of epiglottitis. Hopefully it helped you get a baseline understanding of this condition, how to identify the signs and symptoms in your patient, and some treatment and preventative measures. If you have any questions or if you have anything to add, please comment down below. Thank you for watching this lecture.